I want to thank everyone for joining us today for our Week of webinar series. Normally we like to host roadshows across the state, and due to the current COVID-19 pandemic, we can't really have gatherings larger than 10, and we really don't want to, put anyone at risk. So this is our first Week of Webinars series. So we're excited to host this, and excited that you all are taking the time out of your day to join us for all the material we will be sharing this week. So we look forward to hearing your feedback throughout the week. I know that our team has a lot of great information to share. They're looking forward to the virtual event. They've really implemented some cool different features of Zoom to get participation throughout the week. So it's gonna be a fun-filled week. Excuse me. So looking at the Kentucky Regional Extension Center's mission, so we have actually, we're currently this year celebrating our 10 years of service. So we are wanting to be, and we are the trusted advisor for healthcare organizations, whether they're small or large, across the state of Kentucky. We're also a strategic partner in improving healthcare quality, helping you reduce the cost in delivering healthcare, and really, improving patient care across the Commonwealth. So we want you to be a partner with us in the initiatives of improving patient care and improving better outcomes. So I'd like to quickly point out, over our 10 years of service, we've assisted more than 5,000 providers across Kentucky. This involves around the quality and payment program, the meaningful use, now known as promoting interoperability, MIPS, any CMS initiatives, along with HIPAA privacy and security. So we help provide support to primary care providers, specialists, inpatient facilities as well. We've focused over the past 7 or 8 years also working with our federal qualified health centers and our rural health clinics across Kentucky. And then we also have a strong focus on our inpatient facilities around privacy and security. So those are, really looking at how we've provided support across the Commonwealth. Those are the different provider types, clinician types we support along with our inpatient. Looking in particular of our services, and I always feel like this is a really impressive lineup of services, because when we were originally formed in 2010, we had some funding from the Office of National Coordinator to go out and support physician practices on the implementation of electronic health records. And they also provided funding around inpatient as well. But as that grant came to an end, one of the things we needed to be able to do is to become sustainable and to continue to support our practices with quality improvement, with better patient care. So we really took those service lines that were grant focused and decided how can we turn those either into additional grant opportunities with some of our partners where they help fund our advisors, or we set up a fee-for-service model. So we work with practices still that were part of that grant, and we also work with a lot of new practices across the Commonwealth. So we work with them on promoting interoperability. So that's formerly known as meaningful use. That's where we really got started with providing services across the Commonwealth. We also have our HIPAA privacy and security and project management and vulnerability service line. We have a patient-centered medical home, patient-centered specialty consulting service line. And this one is a pretty interesting service line because, we can help your small practices if you're interested in becoming patient-centered medical home accredited, or a health system in a different instance. We have our value-based payment and QPP, quality payment program support, and quality improvement support. A service line we've been working on over the past year. And it's really, been on the fast pace due to COVID-19 over the past 5 months is our telehealth service line. And we've really, looking at how to model that service line, we've made a lot of different changes because practices really started implementing telehealth at a fast pace, starting in March, on making sure they could provide care for those patients that they didn't want to, bring into their care setting. So now, that service line, we're looking at how to reevaluate and make sure that we can put in the proper workflows. Are we using technology that we can continue to use once they reduce or go back to the normal regulation? So we have a lot of different telehealth services out there that we can help tailor to your needs. On our inpatient services, we have our promoting interoperability. So for those hospitals, not wanting to have a negative impact or negative payment adjustment on Medicare, we work with them on promoting interoperability. Privacy and security analysis and project management. So the hospitals that are really wanting to focus on being HIPAA compliant, staying HIPAA compliant, and staying up to date on the most recent changes of HIPAA, and doing a risk analysis and identifying any risk they have within their organization. That's a service line for them. And then our hospital quality improvement support as well. Pointing out, as I mentioned, my name is Brent McCune. I'm the Managing Director at the Kentucky Regional Extension Center. We also have Megan Housley. She is over business development. And then Kim Dameron is our operations manager. I'd also like to go through our advisors individually, because I know a lot of you all on the call right now work with them, and you may not realize that they work on different service lines. So also, I think it's important to point out that we have advisors that are strategically placed across Kentucky, from Western Kentucky to Eastern Kentucky. So from like Paducah to London, we have someone in Bowling Green and Bardstown. So we're throughout Kentucky, so we can help those healthcare organizations all across the Commonwealth. So I'll start off with Robin Colonel. So Robin Colonel works on our telehealth service line, promoting interoperability, and also as a quality improvement advisor. Laura Wright is telehealth, promoting interoperability, quality improvement advisor. Amy Daly works on promoting interoperability, and she is also a HIPAA advisor, so she works with inpatient and outpatient practices on those privacy and security risk analysis. And we have Seth Taylor, that is our HIPAA lead advisor. Christina Feathers, she's promoting interoperability and quality improvement advisor. Vance Drakeford, quality improvement and patient-centered medical home advisor. Kristen Gardner, promoting interoperability, patient-centered medical home advisor. Michelle Hibbert, promoting interoperability and quality improvement advisor. We have Jessica Elliott, she's quality improvement advisor. We have Kelly Fountain, quality improvement advisor and promoting interoperability advisor. Brent Doon, quality improvement advisor. Mary Levisi, promoting interoperability and quality improvement advisor. And Megan McIntosh, quality improvement advisor. And we also have our business development team. So this team has worked very hard over the past couple of months putting together a week of webinars. But you also hear from them reaching out, letting you know of any new grant opportunities we have or fee-for-service lines that we've made available. And so Mindy Ross is our business events and coordinator. And then we have Catherine Shaw, Autumn Johnson, and Stephen Williams that are business development assistants. So looking at our week, we have a filled week from every day from 12 till 2. We added the 1 to 2 sessions for our central Kentucky folks that are on the central time zone, so they could actually join as well during their lunch period as well. So starting off today, we've already had our Getting Logged On session, so we hope that everyone was able to join that session to kind of learn some of the features of Zoom we'll be using throughout the week, such as polling or annotating on the screen. And then we also have, so right now we're in our walkthrough series. Then today we'll have our telehealth, the fatter future, and then at 1 o'clock they'll also kick off our HIPAA and how well do you know your business associates. So getting to know your business associates, especially during this time, is probably pretty important because we're all working virtually or have some type of dealing with our third-party vendors on implementing new technology to care for our patients. Tomorrow, we have our promoting interoperability for hospitals. And then we have our patient-centered medical home and specialty practices. And then 1:30 to 2, we have stress-free quality improvement implementation, which I'm sure everyone's probably thinking stress-free. Long shot. But yes, our advisors make it stress-free. On Wednesday, join us in the morning for any questions. So we'll have our advisors available from 8:30 to 9:30. So log in anytime. And if you have questions about a particular program or something we reviewed over the previous day that we didn't answer or you didn't get to ask during our sessions, please take this time to join in and ask our advisors any questions you might have. Wednesday afternoon, we do have a repeat of one of our sessions. So we have 2 repeats this week. This is just one of the sessions. So how well do you know your business associates? And we just feel like it's pretty important during this time. We have our midweek check-in. So we'll have one of our managers just checking in, see how it's going, make sure that no one has any questions. And then from 1:15 to 2, we have our quality payment program. On Thursday, we have our quality payment program, exploring the evolution and defining value. As you probably know, we've had a proposed rule drop at the beginning of last week. So our team's been looking at that. So they might be able to, talk about some of the proposal in there. It really depends on how much they've got through the rule and to see what the impacts are. At 12:30, we have our partner KYREC. The Kentucky Health Information Exchange. So, and what they can provide in meeting the MIPS and promoting interoperability measures. From 1 to 1:30, we'll also look at Medicaid promoting interoperability for EPs. And then 1:30 to 2, some additional assistance, KYREC, meeting MIPS, and promoting interoperability measures. On 8:14, we have breakfast with KYREC starting off at 8:30 to 9:30 in the morning. So if you want to join KYREC and discuss any connectivity, any of their new HIE functionalities they've implemented over the past couple of years, this is an opportunity to sit down with that group and kind of discuss what they have going on. And then 12 to 1 o'clock, they have their new services 101 ePartner Viewer provider portal demo. If you've not seen this, I highly recommend that you join that session. And then 1 o'clock to 1:45, our grant opportunities and our wrap up. As I mentioned, these are just our open sessions for anyone that wants to get logged in. So, or log in and have coffee with advisors, breakfast with KYREC, and then learn how the REC can help you. And then our KYREC partnership, as I pointed out a minute ago, these are the KYREC sessions that will be available. So if you want to learn more about KYREC and using them with MIPS and promoting interoperability, and to learn about the new services they've implemented with their new vendor, this is a great opportunity to sit down and hear what they have to say. Also pointing out, this is important that if you're on the call and you're wondering how to get in contact with KYREC and who your outreach coordinator is in a region, then we'll have this screen. We'll probably need to send out a map, so we'll make some changes to this before I send out the slides so you can actually see what region 1, 2, and 3, and 4 stand for. And last, if you need to get a hold of KHI, they have a great website, khi.ky.gov, or you can give them a call at their 502 number there above. Also, I'd like to do a special thanks to KHI and our Kentucky EHR and SNP program. For the past 10 years, we've always partnered with them doing our road shows. This is one of the first years we've not been able to travel across the state and to meet one-on-one with our clients and to talk about all the great opportunities and what everyone's doing across the state of Kentucky. So they've always partnered with us to travel with us for those events. And so I'd like to say a special thanks to them because they will be joining us on our promoting interoperability, and they are part of our agenda this week. And then last, this is, if you have any questions, please reach out and contact us. You can reach us through our phone number, 859-323-3090. During the week of webinars from 12 to 2, our phones will not be available because our business development team is helping host this great week of webinars. But you also can check us out on our website. We have all of our services up there. We update our website on a regular basis, so it doesn't, as new rules, legislation, services come available, we continue to update those. We have a blog post available also. If you want to go out and sign up for our blog post, you'll get monthly and weekly updates on different changes, new legislation, new regulation, new services. So definitely go out there and check that out. We are also on Facebook, Instagram, and LinkedIn.